The right way to have oral sex. Now, what is oral sex? Oral sex is using your mouth, your tongue to stimulate a person sexually or to give a person pleasure. Now, this could be a man or a woman. Hi there, how you doing? Welcome back. Don't forget to smash that subscribe button. It doesn't bite. We are also going to be looking at if it's okay to spit or swallow cum. So what are we waiting for? Let's roll in. Oral sex is a sexual act that is carried out by several people across the world. And a lot of people don't know how to have oral sex the right way, the healthy way. Now, a lot of people just thinking that putting your mouth or your tongue on someone's genitals for stimulation or sexual pleasure is just it. No, there's a way to have oral sex, protecting yourself and protecting the person, and also while giving yourself and the person pleasure. Now, we are going to be looking in details the health benefits and also the sexual benefits. But before that, I want us to talk about the types of oral sex. Number one is fellatio, using your mouth, your tongue to stimulate a man's genitals. Cunnilingus, using your mouth, your tongue to stimulate a woman's clitoris or genitals. Anilingus, using your mouth or your tongue to stimulate the anal passage or the anal area. Now, some people will be asking, is oral sex really necessary? Yes. In some relationships, oral sex is really necessary, especially if your spouse is very stressful and some ladies don't easily have vaginal orgasms. So it's very important that oral sex be incorporated. Now, this should be something you discuss with your partner before you start, before you even get married, or before you even start the relationship. Because some people are bounded by cultural beliefs, religious beliefs, and others. So it's very important not to miss out these important questions. Are you okay with oral sex? What type of oral sex are you into? That you have to have these discussions. And sometimes when a woman is too stressed up, this is the best thing to give her. When a man is too stressed up, this is the best thing to give him. You know, going through a lot of challenges, having a lot of erectile dysfunction, sexual dysfunction, oral sex may be the best option to rescue a relationship or rescue a marriage. Yes, I can tell you that. Now, you don't just do oral sex on anybody. Even the person you are married to must be hygienic. You need to love water and love some soap. And love a body towel or a body sponge. You need to learn how to clean yourself. I've done several videos on this channel on hygiene. Now, for a lady, you must wash your genital area with soap and clean water. I didn't say put the soap into your vagina. The soap is to take away the oils, take away the sweat and the dead skin cells. And definitely you need a towel to wash with, a hand towel to wash that area with. Same as a male. You need to do the same. If you are uncircumcised, you even need to wash more often. In fact, I advise everyone who is sexually active to shower before sex and after sex. I did a video on the things you should do before sex and after sex in order to stay healthy. Please watch so that you stay in amazing health. Do not limit your lifespan because you were careless with your sexual health or with your reproductive health. Don't cause yourself a lot of pain, a lot of infections, and you're taking medication for something that you should have used wisdom to prevent. Now, when it comes to transmission of infections during oral sex, it's not determined by looking at someone physically or by smelling or seeing their vaginal fluid or their penile discharge or seminal fluid discharge or cum. You cannot look at someone physically and determine if the person is a fabulous candidate for oral sex. It doesn't work that way. It is important for you to know that there are some people who are heavily infected but do not show the symptoms. Yes, they are. They may be carrying this microbe in their body for years and it hasn't shown one symptom. Remember that everyone's general health or immune system is totally different. So you may be very susceptible to infections. You may have a low white blood cell count. You may be neutropenic. So, or you may have an ailment or a health condition that you may not be aware about that exposes you to even worse health conditions. So I'm here to guide you on the right way to have oral sex. Microorganisms that are transmitted through oral sex are viruses, parasites, bacteria, and fungus. Now, these microorganisms can be transmitted through the saliva in the mouth and through the fluid that comes out from the genitals of a man or a woman and from the anal passage, the discharges that come out from the anal passage. Remember that it's not only the saliva in your mouth that can carry an infection, your tongue too can, your gums too can. So most people who are struggling to treat mouth odor, please don't even try it. Don't even try it. Don't even try it. Don't even try to have intimacy or oral sex with somebody who has mouth odor or a hole in the tooth, gingivitis, cavities. That will be your worst nightmare. Yes, I said it. Worst nightmare. Number one disease you can get is oral candida or oral thrush caused by fungus. Now, this is very common because a lot of women are prone to this, whether you're taking antibiotics for a long period of time, whether you clean yourself in the wrong direction, other reasons or other causes of this vaginal thrush. Now, what are the symptoms? In the mouth, you're going to have the linings of your mouth, of your jaws, white, your tongue white, and most often people who have oral candida, oral thrush, struggle with terrible or horrible mouth breath. And you can transmit this from your mouth to the genitals and from someone's genitals to the mouth. Now, men also have a penile fungus, particularly those who are uncircumcised. So be warned about this. It's not only a man's cum that may contain microorganisms, a man's precum, his seminal fluid discharge, what is used to lubricate the passage before sex, can also cause infections. Oral herpes is caused by the herpes simplex virus. In most patients, it is not even noticed, no symptoms at all. Oral gonorrhea is caused by bacteria. Now, in some cases, the symptoms are fever, a flu, some have a cold, some feel malaise, some develop a sore throat, tonsillitis, whitish spots in the mouth, on the tongue, and also a bad breath. Oral syphilis, caused by bacteria as well. It will cause tonsillitis, sore throat, lesions on the lips, lesions on the tongue, white patches in the mouth, and a whitish tongue for some people. And in some people, it may give them a flu, and in some people, they have no symptoms at all. Oral chlamydia, some symptoms are a fever, lesions in the mouth, white patches, sores on the tongue, and also on the lips. And in some people, there are no symptoms at all. Oral hepatitis B and C. Now, for hepatitis B, you have dark urine, jaundice, and a lot more. In hepatitis C, you're going to have a swollen abdomen, fever, and some other abnormalities. HIV/AIDS. The symptoms are you're going to be having recurring infections, and most times it's asymptomatic. There are no symptoms at all. You can lose weight. You're always fatigued. Oral human papilloma virus. And in this case, you have swollen tonsils, swollen lymph nodes, you have a fever, you have a flu, and sometimes no symptoms at all. And from the anus, you can actually get E. coli from the anal area into the mouth. And this can actually damage the lining of the intestines and cause you intense stomach cramping and pain, and also infections. And in some cases, those who actually have this E. coli from the anus in their intestines can begin to vomit and develop a fever. Other parasites that can be transmitted from the anus into the mouth are Giardia, Shigella. So it's very important that you know how to have sex the right way. Look, if you have a viral infection, if you contract a viral infection, trust me, it can't be treated. All you're going to be doing is taking viral tablets or treatments to suppress the symptoms, but viral infections are never treated. So what is the right way to have oral sex? Number one, you and your partner must be tested. You must carry out blood tests. Vaginal swabs, you must do your biograms, antibiograms for both your discharges, and then both of you can then have the discussion and get into it, how you want to do it and where you want to do it, and that's going to be amazing. It is important to know that no test can be done, no blood test can be done for the infections that are gotten from anilingus. And you know, this parasite, this Shigella, Salmonella, and E. coli, they are found in the anal passage. So they are just going to pass straight through your mouth. Now, what I see most people do, what I hear most people do is they actually flush their anal passage, they pump themselves so they can pass out all the feces that may be in their rectum or in their anal area, and then they don't eat for 6 hours prior to their intimate moment with their partner. But there is still no guarantee that both of you are not going to be infected or that you wouldn't have these parasites in your system. All people, everyone who is involved, particularly in anal sex, they are always on drugs. I can tell you this for free. They are always taking drugs, antiparasitic, antibiotics. They are always taking drugs. And those people who indulge in oral sex with anybody they meet, they are always on drugs. They are always feeling malaise, fatigued. They are always struggling with one thing or the other. So please protect yourself. Remember that there are people who are asymptomatic. They can carry a viral infection an infection in their body for a long period of time, and no symptoms are going to be shown. But when they're going to come in contact with you, you're going to start experiencing the symptoms. And bear in mind that some of these infections, when they are not noticed on time, they can lead to infertility in both male and female. It is also important to know that most of these infections may not be noticed in their primary stage. They may be noticed in the tertiary stage, and when it's probably very late. Make sure you use anal condoms. There are anal condoms that are available if you want to carry out anilingus. You can also use condoms, male condoms and female condoms. They do exist. They are on the market. And finally, if you swallow the seminal fluid or the cum of your partner, whether it's the male or the female, it is not dangerous. It is not dangerous. It will only be dangerous if you haven't tested yourselves before getting intimate. This is what you should know. So thank you very much for joining me in today's class. Make sure that when you want to get involved in oral sex, you do it the right way. Don't trust people by just looking at their faces. You can't trust somebody just by looking at them and, you say you're falling in love. Don't allow your reproductive part lead you into a den of diseases. Thank you.